it true that your labia can disappear when you go through the menopause? And have you ever wondered where they go? Firstly, let's make sure we are all on the same page and we know our labia. So your labia minora are the inner lips. The labia majora are the outer lips, and together they make up your vulva. They guard the vaginal opening from friction, from soreness, and they also do contain some nerve endings that can contribute to pleasure. So, do your labia actually disappear? Well, no, not exactly, but your labia can change shape and size due to the dropping estrogen levels when you go through the menopause. Now, estrogen usually keeps your skin plump, moist, and it maintains the collagen. So without it, your tissues can become thinner, drier, and they lose their elasticity, even in the vulva. So the medical term for that is vulvovaginal atrophy, or genitourinary syndrome of the menopause. Very catchy terms. So where do your labia go? Well, the labia majora can lose fat and they can shrink, which makes them look smaller. The labia minora can thin out and they can actually retract, which means they become less visible. So they don't vanish, but they can change. So can you do anything about it? Well, small labia on their own aren't necessarily an issue. But if you do have vulvovaginal atrophy due to these low estrogen levels, you might notice that you get some bleeding easily from the vulva on minimal contact. You might feel sore, or you can be prone to UTIs. In this situation, we recommend moisturisers, using some vaginal estrogen, and pelvic floor exercises to help to maintain the tissue health. If you're having discomfort with sex, or just generally you're uncomfortable after the menopause, talk to a doctor. You don't have to just live with it. Menopause changes your body, but understanding why and how those changes can affect you helps you to feel more in control so that you can get some treatment if you need it. So have you heard this myth before that your labia can disappear?